Welcome. On behalf of Bella, New York City Magazine, and IGEA Brain and Spine, I'm Dr. Adam Lipson.
And I'm Dr. David Poulad.
We're both neurosurgeons with IGEA Brain and Spine. Today we're going to talk about concussion. Classic situation where you see a concussion, there's a collision on a sports field, there's a car accident, there may have been an assault. That person may appear confused, a little dazed, may not remember the event. They may have been witness to have lost consciousness. Those are all the signs of a concussion where there's a temporary loss of consciousness. David, maybe you want to comment to the audience things that they may want to look for if they're concerned their loved one has a concussion.
Things you want to look for are a period of confusion. So you're going to ask the patient some questions specifically about memory. You may ask them if they know where they are, what the date is, what sport they were playing, what period of the game they were in. You'll also try and name 3 items and have them repeat them to you within 3 minutes to see if they have good short-term memory. If they're able to do all these things, they may have sustained a concussion, but there would be less of a concern about having them need to seek any further medical attention.
However, if they fail any of those signs on screening, or if they have any severe nausea or vomiting, if they're weak in an arm or leg, if they're having a impaired vision, those are all signs that they need to go to the emergency room for evaluation. About 3% of concussions can present with some sort of bleed in their head, and those are all things that we need to evaluate in the hospital setting. Fortunately, the majority of concussions don't present with this type of severity. Often after concussion, someone may have some irritability, some change in their personality, they may have some disruption in their short-term memory, they may have some headaches. Most of the memory symptoms improve within a week after the initial injury. However, if someone's still having symptoms, we're going to refer them usually for neuropsychologic testing, which includes evaluation of attention, calculation, and memory. It's something that we're going to follow over time, and they really should be seen by a neurologist or a neurosurgeon who specializes in concussion.
If any athlete sustains a concussion and the symptoms are not resolving, they should be taken out of the game for that day, and they should not return to play until the symptoms have resolved. If the episodes are more significant in terms of the length of time of a period of confusion without resolving over the course of a week, then they may be out for the season. But this may also depend on the further neuropsychological testing that they'll undergo.
So concussions are very common. When you look at high school sports, the most common sports that are associated with concussions for men are football, hockey, and soccer. For girls, it's field hockey, cheerleading, and soccer. The majority of these symptoms do go away. If you've had signs of multiple concussions, those are situations where you do need to see a concussion specialist. At that point, we're very happy to answer any questions or concerns if you have about concussions.
Yeah. And we'd be happy to see you in our office for consultation. You can reach us at our office, or you can find us on our website.